Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to continue with the same topic, which is the lifting and moving. And here we are going to discuss about the nurse's responsibility while she or he is lifting or moving the patient from one place to the other. As we know that lifting is a technique in which the patient is moved gently and safely based on the scientific principle, right? So here, whenever you are lifting the patient or whenever you are moving them, when we are moving the patient from the bed to the stretcher, from the chair to the bed, or even from one place to the other, as nurses, what are the responsibilities that we must follow? First, it is your responsibility that you evaluate the situation in which the patient is, because here it would be better if the patient will be able to move by himself or herself, right? However, if he or she cannot, then we can help them by lifting them. So that is why it is very important that before you lift any patient, you should make sure that you evaluate their situation. After evaluating After evaluating the situation, you should also explain to the patient what you are exactly going to do next, because as we know that lifting involves touching, right? So here there may be some patient who might feel uncomfortable as soon as you touch them. So in order to prevent this from happening, what you should do is that you should make sure that you explain to the patient exactly what you are going to do. And also, if required, you can provide certain equipments in order to assist them in moving. So here, after you've evaluated the situation, after you have explained what you are going to do, and also after you have provided necessary equipment which they may need, what you must do next is that you must make sure that you adjust the chair, the stretcher, and the height of the bed. And here it is very important that you not only adjust the height of the bed, but here you must make sure that you lock the wheels of both the bed as well as of the stretcher or of the wheelchair. You must hold the patient close because this will help to keep your balance trained on the arms as well as on the back. Keep your feet apart in order to provide a stable base. And you can also use the gentle rocking movement in order to assist the movement of the patient, as well as if you need the help of others, then you must make sure that you call them as well as instruct them, so that they get an idea of what they need to do in advance, as well as so that there will be a proper coordination between you and the one who is helping you in moving or lifting the client. So these are few of the nurse's responsibilities that one can do in order to move or lift the patient. However, this is only done for those who are not suffering from any chronic illness or who are not. So these are few of the general responsibilities that a nurse must perform whenever she move or lift the patient. And these are usually done for the clients who are suffering from any acute condition. However, if you encounter any client suffering from chronic condition or who is chronically ill, then you must first make sure that before you move or you lift the client, you must perform the preliminary assessment check. So here what you will be doing is that you must first see the doctor's order for specific precautions. You must assess the general condition as well as the diagnosis of the patient so that you get a good idea of the patient. You must assess their level of consciousness, their self-care ability, the mental status in order to be able to get a clear idea if they are able to follow whatever instructions has been given by you. If there is presence of any tube or line, example Foley catheter, the number of personals which may be required in order to move or lift the patient, as well as you must also assess that the equipment which may be required for moving the patient is available, such as the stretcher, the wheelchair, the IV stand, as well as the clamps for the disconnected tubes. So here, before you lift any patient, especially those who are chronically ill, you must first perform the preliminary assessment check. After this has been done, then you must prepare the patient as well as the environment. And how will you do this? You can do this by first explaining the procedure to the patient by providing privacy, by adjusting the height of the bed to the working height. As I've said that before you move the patient, you should make sure that you adjust the height of the bed as well as the height of the stretcher or the wheelchair which you are going to move the patient in, by providing the bedpan or the urinal if it is required, by removing all the comfort devices which was provided to the patient to enhance their comfort level, and also by removing all the comfort devices which was provided for the patient in order to enhance their comfort level. And if the patient is under catheterization, then you must make sure that you clamp the catheter in order to prevent the backflow of urine during the transfer. And if there is also presence of tubes such as nasogastric tube, then this must also be clamped, as well as you must place the footstool if it is required. And if possible, then you must also try to encourage the patient assistance. So this is how you can prepare the patient and the environment before you move them. That is by explaining the procedure to them, by providing privacy, by making sure that all the articles which may be required will be available, by also making sure that the height of the bed as well as the height of the stretcher or the wheelchair to which you will move the client in must be of the same, by also making sure that if the client is under catheterization or if any tube has been inserted, then all of these must be clamped, by removing all the comfortable devices, and also by encouraging the client in order to assist himself in this movement or call for assistance if required. So here when I talk about moving, it does not necessarily mean that whenever I say move the client, you should only move him or her from the bed to the stretcher or from the bed to the wheelchair. Here you can also move the client in the bed himself, whereby you can change the position. That is, from supine position, you can move them and make them be in the lateral position, which is the side lying position, or you can also help the client sit on the bed, right? So here, after you have prepared the patient as well as the environment, when you need to move the client in the bed himself, that is when you need to make the client change his position. Let's say if you need to make the client change from a supine position to a lateral position, you must make sure that you wash your hands and dry it. After that, you must place the bed in a flat position. You must wash your hands and dry it. You must place the bed in the flat position. And here, since the client will be in a supine position, then the nurse must place their hand on the bed, sliding them under the patient's head, shoulders, chest, hip, and the legs. So here, after you have slide your hands on these areas, then you must wait for the leader signal, counting 1, 2, 3. And when the leader counts 3, then you must move the patient to the side of the bed using the right angle pull maneuver. So here, whenever you need to change the position of the patient from the supine to the side, what you must make sure is that you must wash your hands, you must dry it, you must make sure that the bed is in a flat position. Then when the patient will be in a supine position, you must slide your hands in the patient's head, shoulders, chest, hips, and the legs. So here, whenever you so these are the various steps that you must follow when you move the position of the client in the bed itself from the supine to the lateral position. That is, first you must wash and dry your hands. You must make sure that the bed is in a flat position. You must also make sure that the client must be in a supine position, and then you can call for assistance, where your assistants as well as you will be placing your hands in the patient's head, shoulders, chest, hips, and the legs. And here there will be a leader who will be counting till 3. So once the leader counts 3, what you must do is that you must move the patient to the side of the bed using the right angle pull maneuver. And when you need to assist the patient to sit on the side of the bed, then again here you must first wash your hands and dry it, and then you must make sure that the patient is in a supine position. You must flex the knee. You must also flex the knee of the left leg gently. Support one of your hand in the shoulder and the other on the hip of the patient. And also, if it is possible, then here you must advise the patient to slide their heels off the edge of the bed, and simultaneously while he or she is doing this, You must raise their head and their trunk, and here you must also assist the patient. Raise their head and their trunk, and here you must also assist the patient. Raise their arm and trunk, and here you must also assist the patient to place both their arms extended with their palms supporting on the mattress as well as their feet on the floor in order to maintain a sitting position. So here, whenever you are assisting the patient from the supine position to sitting at the edge of the bed, this is what you must do. And here, whenever you need to shift the patient from the bed to the stretcher, then here you must make sure that you first position the stretcher at the right angle to the head or the foot of the bed. You must call helpers and position them at the bedside, as well as you must move the patient to the edge of the bed so that it will be easy for you to shift the patient from the bed to the stretcher. Here again, there will be a nurse leader who must count till 3, right? So here on the count of 1, you must make sure that you slide your hands. And also here, there will be a leader nurse who will count till 3. So here on the count of 1, the nurses must make sure that they slide their arms under the patient in order to support the body section of the patient, holding the patient near to their body as much as possible. And at the count of 3, the nurse must take one step forward and pivot on their heels towards the stretcher. And here too, there will be a nurse leader who will be making a count till 5. So here on the count of 1, the nurse must make sure that they slide their arms under the patient in order to support the body section of the patient. Whereas on the count of 2, the nurses must stand with their back erect, holding the patient and pulling the patient close to them as much as possible. On the count of 3, the nurses must take one step backward and pivot on their heels towards the stretcher. And on the count of 4, the nurse must move to the side of the stretcher and stand with a wide base and a flexed knees ready to lower the patient to the stretcher. And at the count of 5, the nurse will then lower the patient to the stretcher in a back lying position. So whenever you need to shift the patient from the bed to the stretcher, these are the various steps that you must follow. And if you need to assist the patient from the bed to the chair or even to the wheelchair, here the first thing you must do is that you must place the wheelchair or the chair on the right side of the bed. The wheels of the bed as well as of the wheelchair must be locked. You must also assist the patient to sit on the right side of the bed. So after the patient has seated on the right side of the bed, the nurse must stand in front of the patient facing them. We must also advise the patient to slide their buttocks close to the edge of the bed by shifting his weight alternately from right to the left buttock. By shifting his weight alternately from the right to the left buttocks until his feet is placed on the floor in a forward, backward, wide base position. And here you must also make sure that one foot of theirs must be placed back of the other slightly under the bed. You must also tell the patient to stand on command by simultaneously leaning forward as well as pushing by the foot which is placed at the back as he straightens his legs. The patient can also stand upright by balancing himself on the armchair, the mattress, or even the side rails. We must also tell the patient to place their left arm on the farm arm of the wheelchair and pivot on the heels of their feet as well as bringing their buttocks towards the wheelchair. And here, while they are doing this, you must also ask the patient to step back to their wheelchair until he or she is close enough to touch the seat of the wheelchair as well as to grasp the other arm of the wheelchair with his right hand. So here, as he is close enough to touching the seat of the wheelchair as well as if he has grabbed the right arm of the wheelchair as well, then you must tell the patient to lean forward as well as lower his buttocks. Then here you must tell the patient to lean forward and lower the buttocks slowly to the seat of the wheelchair by bending their knees and elbows. And when they are seated, then you must also make sure that you observe for the correct sitting posture. So here, these are the steps that you must follow whenever you are assisting the patient from the bed to the chair or even to the wheelchair. So till here we have discussed about moving the patient from one position to the other, as well as moving the patient from the supine position to the sitting position at the edge of the bed. We've also discussed about shifting of the patient from the bed to the stretcher, as well as shifting of the patient from the bed to the wheelchair or even to the chair, right? So here, after you have performed all those steps which is required, and after you have moved and shifted the patient accordingly, you must make sure that the patient is in a correct alignment and is comfortable. You must also replace the pillow as well as the other comfortable devices if required. You can also raise the side rails for the safety of the patient. And here, if the patient assumes a sitting or a standing position, as a nurse, you must make sure that you should always remain with the patient. So here, after you have performed all the procedure which was required for that particular patient, at the end, you must make sure that you wash your hands thoroughly, as well as record the procedure in the nurse's record. So these are the various procedures that these are the various steps that you must follow whenever you are moving or shifting the patient. So now here we have come to the end of this topic. In today's session, we have discussed about the nurse's responsibility in moving as well as shifting. So now we have come to the end of this session, whereby in today's session, we have discussed in detail about the nurse's responsibility in moving and lifting the patient. So I hope you have got a clear insight of this topic. I'll be meeting you in another session. Until then, have a good day. Thank you.